Good morning, Peter Goertz. I'm a psychiatrist. Benefits versus risks of psychiatric medications. As a psychiatrist, and of course, mainly as a patient, it's a day-to-day struggle. And what made me think of this week is last week I was in my office sitting in front of a patient and her neck was twisted, probably from tardive dyskinesia, torticollis, from years and years of antipsychotic medications. And I'm thinking, what am I doing here? Is this really overall a benefit for the patient? And I had another patient last week who was telling me about jerking movements, and I'm wondering, oh my God, is this from his antipsychotic medication? Of course, it could be something else in that case. So this type of thing, of course, is a real problem for patients, and it also brings up some feelings for psychiatrists. Again, I was just sitting in the office thinking, wow, what am I doing? And it's an individual decision for a given patient at a given time. Unless there's an emergency, it's a patient's decision. Do you want to keep taking the medicine? Do you not want to keep taking the medicine? And of course, being psychotic is a major problem, at least often, if they have behavioral problems due to the psychosis, accusing staff or accusing family of stealing from them, getting very upset, agitated, hearing voices telling them to hurt themselves or someone else. So of course the psychiatric problems can be major issues, but then of course also the side effects of medicines can be major issues. The medicines can of course help with depression, mania, anxiety, various things, psychosis of course, insomnia, inattention. But then you have the other side of the coin, you have the side effects. So one example, a patient I remember from working on a hospital ward many years ago, she was treated for psychosis with Abilify, but then became quite restless, what we call in psychiatry akathisia, inability to sit is the literal translation. And that was quite troublesome for her. And you could treat that with another medicine, but that of course can have side effects too. So it can be like a domino effect or going in circles. You have a side effect, then you add another medicine for the side effect, which also has side effects. So for the akathisia from Abilify, we could have added, for example, propranolol, a beta blocker, which can also have side effects. Another patient I remember from residency, a chronic, very sweet gentleman, chronic schizophrenic gentleman who had been in our clinic for years and years, and I was seeing him for my 2 years in the resident clinic. And he was on Haldol, chronically psychotic. And I thought, well, and I discussed it, I think, with my supervisor. We thought maybe let's try a different antipsychotic. So we tried Risperdal, which was relatively new at the time. And the poor gentleman became impotent. So in addition to his psychiatric problems, now he had the sexual problem. So we switched him back to Haldol. Another patient I was recently talking to is a lady who gained quite a bit of weight on Remeron, mirtazapine. And she liked the medicine though, so at that point she didn't want to stop it. At the next visit, we may want to revisit that issue. Of course, especially for ladies, it's not only a health issue, but a cosmetic issue. They don't want to be, overweight. Another patient I had not that long ago was drooling a lot on clozapine, even had some breathing difficulty, maybe from the drooling at night. And he had severe psychosis, so that's why he was on clozapine. But the side effects ultimately were just too difficult, and that medicine was stopped. So bottom line, we're between a rock and a hard place in these situations. You want to do your best to help patients with serious, troublesome psychiatric symptoms and signs, but you also don't want to give them more problems, physical problems, weight gain, high blood sugar, high cholesterol, etc., etc., etc. So we're really in a bind, and as a psychiatrist, again, you're wondering, wow, am I overall doing what's best? But again, ultimately, it's the patient's decision, a risk-benefit analysis or discussion, and then we do the best we can. Now, one thing that's important, in my opinion, is to not forget medicines are not the whole spectrum of treatment. So, for example, a day program can be enormously helpful. Social activities, for example, in that day program can really work very well. Simple things, whatever patients enjoy, having an animal, having a pet. So it's not just about medicine. We don't want to ignore other things. Another patient I saw last week with autism, he had become quite agitated, and over the years it was possible to sedate him with medicines, but that in the long run is not very helpful necessarily either, just to keep someone so sedated they're in bed all the time. And it seemed like he could benefit from living in a facility where there was staff that could help him maybe with some social stimulation, with some activities potentially. Of course, our psychiatric and medical systems only can offer so much. Cost is a major issue. So the flip side of this coin that I'm talking about today is, the good thing is there's plenty of room for creative thinking, for research into possible better options. We want to keep an open mind. Thank you.